Hoffman, and I am the Director of Community Engagement for North and West Colorado. I serve 10 counties. I'm based in Larimer County, but I serve all the counties going west to the Utah border, down into Grand Junction and Montrose Delta, of kind of that area. And so very much appreciate you all inviting me today to speak about Alzheimer's and dementia. I've been in this field of gerontology for 30 plus years, well over 30 plus years, maybe I should say 40, a really long time. And also, I'm living the experience as well with my husband's mother, so my mother-in-law and my husband's uncle, as well as my mother, who are experiencing some memory issues. So professional and personal experience. So I'm going to talk vision, a world without Alzheimer's disease and all other dementias. Our full name is Alzheimer's Association and Other Related Disorders. So we are about all types of dementia, and I'm going to explain the difference between Alzheimer's disease and that word dementia. So we have a pretty lofty goal. You may have participated in some of our walks to end Alzheimer's. We have over 630 across the country. And so that's one of our biggest fundraisers and how we support the research that we do, because we are the largest funder of research around the globe for Alzheimer's and other dementias. So again, the question that we get asked the most, what's the difference between Alzheimer's and dementia? I was just doing a presentation yesterday and someone brought this question up. And professionals ask us this, as well as lay people, family caregivers. So dementia itself is not a disease. It's a compilation of symptoms or a syndrome. And so with one of the most common type of symptoms that people think of when they hear that word dementia is problems with short-term memory. So problems with short-term memory, but it's a lot more than that. It involves problems with reasoning and judgment. There may also be personality changes. And all of this is enough to impact someone's daily living. So again, it's just a very generic term. And under that term are the different disease processes that are making those dementia symptoms occur. Alzheimer's is the most common reason of why those dementia symptoms are occurring. We think 60 to 80% of all dementias are thought to be Alzheimer's disease. Alzheimer's disease has very specific proteins that are causing those dementia symptoms. So beta amyloid and tau are the hallmark proteins of Alzheimer's disease. And we know that the beta amyloid clumps together in the brain. Those proteins clump together in the brain. And the neurons have a really hard time communicating to one another then. And then the tau is a protein that's actually in the neuron itself that twists upon itself and collapses and causes cell death. And so, two things are happening. The neurons can't talk to one another because that beta amyloid clumping is in the way. And then the cells are actually dying. And it's a progressive brain disease that typically starts in the hippocampus. And that's where we form short-term memory, which is why with Alzheimer's disease in particular, you will notice problems with short-term memory as one of the initial symptoms that people have. Vascular dementia is the next most common type. Vascular dementia is just like it sounds. It has to do with a person's vascular health in their brain. So they might be having little microbleeds or little mini strokes. And these are progressive. They continue on. And then dementia with Lewy body, you may be familiar with because the actor Robin Williams had dementia with Lewy body, we know now from autopsy. Dementia with Lewy body is a little bit different. It has a protein called alpha-synuclein that is causing these dementia-like symptoms. And with dementia with Lewy body, short-term memory is not the first kind of hallmark symptom. Usually people might be having very vivid dreams and they're acting out in their dreams. There's a lot of movement with their dreams. They might accidentally hit their spouse in bed because there's so much movement with their dreams. Hallucinations are really common with dementia with Lewy body as well. And also something called proprioception. So how we move our body in space. How do I get my body to sit down in a chair? That mind-body connection is becoming a challenge. Frontotemporal dementia. It's another type of dementia that's been in the news recently because the actor Bruce Willis has frontotemporal dementia. Frontotemporal dementia has a couple of variants. One is a behavioral variant, and one is an aphasia variant, which is what Bruce Willis has. And so that ability to understand communication and then that expressive communication, being able to speak back, which is, again, what Bruce Willis has. Frontotemporal dementia typically occurs in people a little bit younger age, so anywhere between the ages of 40 and 60, and not so much in late life, although there's always exceptions to the rule, so to speak. But these are by no means the exclusive list. These are just the most common types. And there's also something called mixed dementia, which is a combination, which we're finding out is a little bit more common than we ever thought. So again, these are the differences and the different disease processes that are making those dementia symptoms occur. So we use them very interchangeably. That word dementia and Alzheimer's, just because Alzheimer's is the most common type. So who is at risk for developing Alzheimer's disease in particular? Age is the greatest risk factor. So the older we get, we have an increased risk. 1 in 10 people age 65 years of age and older are living with dementia. And that number goes up to almost 1 in 3 by the time someone gets to be 85 years of age. But it is not a normal part of aging. And I'm going to really talk about at the end of this talk here that our genes don't have to necessarily be our destiny. I'm going to talk about hereditary genes here in a minute. But that the Lancet Commission came out this year and said almost 50% of all dementias can be avoided just by our lifestyle factors. So I'm going to talk about that. We do know that if you have a family history, if you have your parent or a sibling that has Alzheimer's disease, you do have an increased risk. And why that is because there are a couple of genes. We have deterministic genes, meaning if you carry one of these particular genes, you will definitely get Alzheimer's disease. However, it's 1 to 2% of the world's population, so most people do not carry this gene. Although I know here in Colorado, we have a family in Greeley that carries the deterministic gene, and there's a couple of mutations on some chromosomes. And then there's also a family in Cheyenne that carries this particular deterministic gene. Most of the families who carry a deterministic gene are part of a study called the DIAN study, Dominantly Inherited Alzheimer's Network. It's based out of Washington University. And we owe a lot to these families because we've learned a lot from these families. So if researchers in real time can follow these families and see someone who is changing and know that they are definitely 100% headed down the path to Alzheimer's disease, they are able through biomarkers to watch these changes and see what exactly is happening. So they have advanced the research a lot. And so then we have what we call risk factor genes. And risk factor genes mean that if you carry one of these genes, that you have an increased risk, but it doesn't mean 100% that you're going to get Alzheimer's disease. The most common type of risk factor gene, which you may have heard about, is the APOE4 gene. And so we get an APOE gene from a copy from each parent. And they can be in a combination of APOE2, 3, or 4. So if you have 2 copies of the APOE4, one from each parent, you have an increased risk for developing Alzheimer's disease. We also know that head injury increases a person's risk for Alzheimer's disease. You've probably heard of, professional football players who develop chronic traumatic encephalopathy that from those repeated concussions that they've experienced. And then again, at the end of this talk, I'm really going to talk about lifestyle and how our genes, unless we have that deterministic gene, do not have to be our destiny. That lifestyle plays a huge role in the potential of developing dementia. As we go along, if you have particular questions, please just, like Tanya said, raise your hand, put it in the chat. I'm here for you to answer your questions. So the other thing is that I think oftentimes people think that Alzheimer's disease in particular, it's just memory, right? That it's just a problem with a person's short-term memory. And we know that that's not the case, that they're very early on in the disease process, a person's vision is being affected. And oftentimes it's depth perception. So a person might still be driving and starting to get into little fender benders. Maybe they're pulling into a parking lot and can't judge the space very well. So they sideswipe a car. Also, if there's a change in flooring, if there's a dark and light flooring, that dark flooring will look potentially like a hole to that person. It's called visual cliffing. So you may see someone kind of step tentatively because they really are having a hard time with that depth perception. We also know as people continue to progress in the disease process that they start to lose their peripheral vision. So they really, towards the end of the disease, really see what's in front of them, not the side. And so it's really important to approach a person from the front. Hearing also becomes affected very early on in the disease process, where people have struggled to filter out all the different competing sounds that might be in an environment. And so if I'm in a restaurant with someone and I'm chatting with my friend, our brains would filter out the other sounds around us so we can really try to concentrate on each other's conversation. Someone living with dementia has a much harder time of doing that. And again, very early on in the disease process. So they might hear the clock on the wall, the clanking of silverware, people walking by, the car outside, just lots of noise at once. And so, again, if you're working with someone living with dementia, if you're helping or involved, you have a family member or a friend, and that person starts to maybe seem a little anxious or even agitated, to think about the environment. And is there too much going on for this person? People also start to lose the ability to initiate activities on their own. And that could be dressing, bathing, eating, a fun activity. And so oftentimes a person might seem to be comfortable just sitting, but they really just are losing that ability to initiate. So if we can help them get started with something, oftentimes they can continue to do it, whether it's placing a fork in a hand, helping someone to start an activity, or putting a shirt on, things like that, that if we can just encourage someone can be really helpful. People also are losing the ability to assess their body, that mind-body connection. And so a person may not feel thirsty or know when they need to use the bathroom, may not feel hungry, may not know that they know they're uncomfortable, but they don't really know why, and they can't even maybe really express it as pain. But you might see a person shifting in a chair, kind of a cue that maybe they're uncomfortable. So that mind-body connection is being lost. The other thing that's being affected, and this goes with most of the dementias, is that frontal lobe is being affected. So a person loses their social filter. So that is where our reasoning and judgment, our executive functioning is. And so we all have thought something, but we've not said it out loud because it's not the right time, not the right place. And we're able to put the brakes on. Someone living with dementia sometimes, oftentimes, is not able to put those brakes on. So they may say things that seemingly seem very inappropriate, sometimes just not kind, because they don't have that social filter. They can't put those brakes on. So they really are saying what they're thinking. And so we have to be mindful that this is the disease and the dementia. And the other thing is that quote unquote behavior. We think of behavior as this person's way to communicate. So oftentimes, as the person progresses in their disease process, they start to lose that verbal communication. And so they're expressing themselves in a different way. And again, we think of oftentimes that word behavior in a very negative connotation, but to really think about it as communication. What is this person trying to tell me? So we're going to go over some communication tips. And communication is really important for all of us, whether it's verbal or nonverbal communication, right? It's the way we connect with the world. And so if we can communicate with someone living with dementia, we help preserve their identity. We can celebrate who they are, the person that they are. We can create meaning in the moment and allow you to be in the moment and really connect with that person. So some of the do's for communicating. So the things to get in the right frame of mind. And I like to just bring up a quote. There's a doctor, Dr. G. Allen Powers. He's written lots of books, great books on dementia, and he's been around for a long time. But one of his quotes that always has stuck with me is that we need to change our minds about people whose minds are changing. And he gives the example if he were at the top of stairs in a wheelchair, or sorry, if he was standing at the top of stairs and a person was at the bottom of the stairs in a wheelchair, you can see that person's physical challenge and you would never expect that person to navigate those stairs to meet you, right? But someone living with dementia, we can't see those physical changes in their brain. We don't know what exactly is going on. So we expect people living with dementia to navigate the world in the exact same way that we do, and they can't. So how do we metaphorically build those elevators, bridges, ramps, so that person can navigate the world to the best of their ability? And one of those ways is being able to communicate in a manner that is supportive to that person. So getting ourselves in the right frame of mind. Really focus on your nonverbal communication. And we all do that. We're all keyed into nonverbal communication. Like right now, I can't see anybody but myself. But if I was doing this in person, I would get feedback from the audience, right? I could tell if someone was super engaged and really, paying attention to what I'm saying, or is someone really not engaged. And so I would work harder at engaging the audience, right? So that nonverbal communication is really important. And we, again, all use it. And someone living with dementia, especially in the middle and later stages, they're starting to lose that, again, expressive and receptive communication. So they're having a hard time getting those words out. And you can imagine if you could only understand every 3 out of 5 words that I'm saying, you would have a hard time understanding what I'm talking about. So the people living with dementia start to key into that nonverbal communication. What does my face say? Am I smiling or am I scowling? Do I have a stance that makes me seem intimidating, or is my stance very open and engaging for someone? Is my tone of voice saying, "Oh my gosh, I'm so stressed today," or I'm really here in the moment with you and enjoying the moment that we have together? So thinking about all of those things. Use words that might be familiar to that person. I have grandkids that use words that I'm not familiar with. I'm like, well, does that mean that that's a good thing or a bad thing? So find, what are those words that might be familiar to that person? Talk slowly and clearly. If there's nothing else that you remember from what I'm talking about today, is to really slow ourselves down when we are interacting with someone living with dementia. That person is trying to keep pace with us. And so the faster we go, the harder it is. And I know that sometimes, we live in a fast-paced world, but when we're really involved in really connecting with someone living with dementia, we want to slow our pace down. We want to act like we have all the time in the world. We also want to make sure that if we are giving instructions at all, that we don't give more than one-step instructions. Too many overwhelm somebody. Give visual clues. If we are, again, have anything that, if we ask a person if they want to drink a water, maybe we hold up a glass of water. So giving visual clues. And then we always focus on the feelings and not the facts. We always say, choose to be kind instead of choose to be right. That person is based in their own reality that may be very different from your reality, but they can't change that. So how do we lean into that and support them and really just focus on their feelings, not so much the facts that they're saying? So some of the don'ts. We don't want to use reasoning and logic. We do that all the time with everybody when we communicate, right? We really use facts, reasoning, and logic. And with someone living with dementia, they are not using reasoning and logic. So we don't go that route, right? We're just really focused on feelings and making sure that we're supporting them. We don't correct them or try to convince them. Again, their reality is their reality. We also don't quiz people. And sometimes I see this a lot with family members from, very well-meaning, asking questions. Mom, who's this in this photo? Thinking that if they keep this kind of repetitive quizzing, that this person will remember. And they don't. And so it just becomes a futile exercise that becomes very frustrating for someone. So no quizzing or asking too many questions. Now, very early on in a person's disease process, people may still be working, they still may be driving, and you can ask questions. But as a person progresses in their disease process, those questions just become anxiety provoking. And so we want to limit that. And especially if you notice that you're talking to someone and they're starting to feel anxious, to change your conversation and stop asking those questions, which is really hard because that's how we also communicate, using reasoning, logic, and asking people questions, right? And so not asking those questions, limiting those questions. Avoid literal expressions like don't say jump in the car. A person may feel like they need to jump. So we have to think about that. And avoid pronouns. Instead, be very specific. If you're talking about getting a hat, instead of saying it's over there, the hat is over there. Or let's go with Claire today instead of the niece, or which isn't a pronoun, but really focusing on identifying specifically what you're talking about.
Angel, can I ask one question before you move on? I'll get the questions started.
Sure.
And I totally hear you when you said, kind of agree with them, even if it's a falsity, like don't try to change their mind. But I did notice with my mom, like sometimes some of the things that weren't true, it upset her. And she would get really sad, like she would start to cry. And do you still let that go? Or do you try to say that didn't, no, don't worry, that didn't happen?
Yeah, so if it's a particular event that is really distressing to someone and the event isn't true, you can say things like, oh my gosh, so you really just have to lean into the emotion. So, oh my gosh, that seems so sad or so scary or whatever. When you validate that emotion, then sometimes you can try to distract and change the conversation.
Okay.
If we don't validate that emotion, sometimes it makes things worse, that people are like, oh my gosh, you're not listening to me. This feels really frightening to me right now. And why aren't you, you know, you kind of have to really test the waters with that person.
Okay.
And sometimes it can be something that is really not a big deal. My mother-in-law, for whatever reason, is keyed in on that she used to be a barrel racer. She's never owned a horse. She was never a barrel racer. But we don't say, no, you weren't. We're just like, oh, wow. That's interesting.
Yeah.
We don't really embellish it. We don't try to go further than what she said. We just kind of acknowledge it and then see if we can move on. That's harder if someone is distressed, for sure. But oftentimes, if we can say, oh, I can see that makes you feel, well, you're here now. We're here to make sure that you're safe, and just really making sure that, again, when we try to tell someone what they're thinking is not true, sometimes it just makes things worse. Now,
Okay.
if you've had a different experience and for your mom, what you did worked, then that's great too. Sometimes it's what works one day doesn't work the next day. It's a lot of trial and error and just making sure that we're trying our best to support that person and making sure that we're decreasing their anxiety or fear or whatever it is.
Okay. Thank you. I appreciate that.
Yeah. Yeah, so some other tips is just patiently wait for a response. If we have asked a question, that we don't just keep peppering, that we let that person see if they have time to process that information. And sometimes it will be, people can answer, but if make sure that we're always waiting and giving that person plenty of time. If a person seems agitated, try again later in whatever you're trying to do or the conversation that you're having. That oftentimes backing away and backing off can help that person kind of regroup if they're feeling overwhelmed. Writing things down can be helpful, especially initially in the early stages. And again, it's something you have to play around with. If writing something down like, Mom, I'll be here on Tuesday, in the early stages, that might be a helpful note for mom. In the middle stages, the mom might be like, who's coming on when's Tuesday? Why is, that just might create a whole nother thing of anxiety. So again, these things aren't written in stone. They kind of ebb and flow and see what works, what doesn't work, what worked great again one day doesn't necessarily work the next day. So, or sometimes within the day. So again, it's really being a master of adaptation, which, as you know, for a family caregiver can become exhausting, right? Because they're always on their toes, trying to be ahead of the game, trying to help their person, their loved one. But again, we know with these communication tips, we can help create the best environment for that person. So any kind of that fear and agitation can hopefully be limited as well. Providing simple explanations. We oftentimes like to fill in the quiet moments. And so making sure that what we're explaining is short and simple, sweet and simple, not anything convoluted. Again, that person just can't grasp all of that. And again, what's really important is checking our own body language. Are we calm? Are we slowing ourselves down? Are we seeming approachable? Do you have a smile on your face? Those are the things that can really help connect you to that person living with dementia. So now I'm going to kind of switch gears. So before I switch gears, does anyone have any questions at all about communication or the disease process?
Feel free to put it in the chat or raise your hand and I will gladly unmute you if there's anything. We can give it a couple seconds and see if we see anyone raise.
And happy to answer at the end too. So.
Okay. Again, I'll just keep an eye on it. So at any point in time, if you guys would like to raise a hand or put a chat, just let me know. I don't see anything right now, Angel, so go ahead.
Okay, great. So the Alzheimer's Association, I mentioned that we are the largest nonprofit funder around the globe for research for Alzheimer's disease and all other dementias. And from that conference, the Alzheimer's Association International Conference, it happens every year. It happens in different places around the world. It brings researchers together who share what they're learning. And they have also really advanced the science. And so usually it's like end of July, early August is when this conference happens. And then usually during that time, a lot of news comes out from that, a lot of media attention from, well, this is, this year's conference, we learned a lot about wildfire smoke and how that's really bad for our brain health. So a lot of that, let me go to the next slide here. So these are some of the things that came out of the conference this year. And talk about, again, wildfire smoke in particular, which is important to us in the West because we've experienced that. And we know that AQI, the air quality index, is something that we should be paying attention to. And if you're, here on the Front Range, we've had ozone as well. So definitely air pollution, and in particular, wildfire smoke impacts our brain health. We often think about not going outside if we have lung issues, but not necessarily brain that impacts our brain health. So it's really important to pay attention that when the air quality index in particular is over 100, which is still shown in the moderate category if you have one of those apps. But we don't want to be outside if it's over 100 for sure, because that is what the study was based on. Anything over 100 impacts a person's brain health. We also know, and this probably isn't a surprise to anyone, but ultra processed food is really bad for our brain. It's not just it's not just bad for our heart, it's also really bad for our brain. And so paying attention to, sandwich meat that's full of nitrates. And this particular study was also done on particular meats, so and red meats and basically anything like bacon that has, again, all the nitrates in it. Anything that has a long list of ingredients on it that you can't go buy the whole food in the store, and not talking about the grocery store, but a whole food, is probably an ultra processed food. And so to really limit that, pay attention to that. Also, some things that are happening that they're looking at is that blood tests. We're not too far away from being able to go to our doctor in a couple of years. And much like when we have an annual physical and we have blood work done and they look at your triglycerides and your cholesterol, they're also going to be looking at, are you accumulating beta amyloid or tau? And if you are, much like with heart disease, do you need to change your lifestyle, which is, I'm going to talk a little bit more about that, or are you to the point where maybe a medication, there are a few medications out right now, not easily accessible, I will say, they're done by infusion that slow the progression of the disease. However, they're building on this knowledge, and so hopefully at some point there'll be a pill form that either that we have a cure, which is our goal, or something slowing the progression of the disease, or again, lifestyle. We don't want to get it in the first place, right? So my next slide here talks about lifestyle. These are the things that we know that can help decrease the risk for dementia. The original research study was actually done in the Netherlands called the Finger Study. And now we have a study going on here in the US called the US Pointer Study. And it's involved 5 different communities around the US to duplicate. And what it's showing is that our lifestyle factors can decrease our risk for developing dementia. So limiting a traumatic brain injury, right? So wearing the helmet when we bike or when we ski, keeping our core strong so we don't have a fall, especially as we get older, we tend to have some balance issues, and part of that's keeping our core strong. So making sure that we're staying healthy, that alcohol and developing dementia, physical activity. Um, if you want to look at all of these factors, one of the things that you get the biggest bang for your buck is being active. Getting that good vascular blood flow to your brain is really important. So physical activity becomes really important. Education, we also know that the more education a person has, they have a decreased risk for developing dementia. It doesn't necessarily need to be formal education, and we don't all need to be PhDs, and even people with PhDs can develop dementia, right? But that it does mean that the more that we use our brains, that we stay cognitively engaged, that we are lifelong learners, that we stay curious, really good for our brain health. Because it creates new neuronal connections with, vascular health. And again, that exercise is really important. Our diet, thinking about the Mediterranean diet, which is not vegan, but it means that we really concentrate on low fats and healthy fats, lots of fruits and vegetables, and then minimal processed food or not at all, and lean meats. And so thinking about the Mediterranean diet, there's also the DASH diet, which is dietary approach to stop hypertension, really paying attention to your sodium level. And this is from the American Heart Association. Again, it impacts that vascular health. And if you really start paying attention to the sodium that is in the food that you buy at the grocery store, it's amazing how much sodium is in some things. So really paying attention to the sodium and Mediterranean diet, and the two of those together is called the MIND diet. So really looking at sodium level, lots of fruits and vegetables, and lean meats. And that's and healthy fats. Healthy fats are really important too, like olive oil, nuts, those kind of things. So paying attention to those things. And then also we know that getting plenty of sleep is really important as well, right? One of the things about Alzheimer's disease is that when we are in deep sleep, we flush out those toxins from our brain into our cerebral spinal fluid. And some of those toxins are beta amyloid, which is that buildup, which is the hallmark of Alzheimer's disease. So that good sleep is also really important. Do a whole class on that. So this is just kind of highlighting some of the big things. I already talked about the wildfire smoke.
Angel,
And
can I pop in real quick? I did have someone who, and it goes back a little bit to some of your other slides, but Pam's question was, how do you know the difference between just old, kind of, you're getting older age forgetfulness and possibly early Alzheimer's or dementia?
yeah, we have a whole class called the 10 warning signs. And basically, in a nutshell, there are things that we all do, right? We all forget a word or we have lost something. And when we do that, we start to panic, right? Is this the start of something? If you're doing those kind of things occasionally, that is probably normal age-related change. If you are repeatedly having a hard time communicating, pulling up the right word, forgetting frequently, needing reminders everywhere, it doesn't mean you're necessarily going down the path of dementia, but it means that something might be going on, whether it's increased stress in your life, depression, or is it something that I need to investigate further? So what we really encourage people, and at the age of 65, through Medicare's annual wellness exam, your physician should be doing a mini mental status exam of some sort to do a basic kind of cognitive test to get a baseline of where you are. Because we know now with, again, maybe we need to increase these lifestyle changes, that we know that there are things that we can do to help us not necessarily head down this path or decrease our risk. If we're already headed down this path, it's something that we want to know because then there are lots of other things that we can do to help improve our quality of life. Maybe not change the trajectory, but slow the progression. So anything that, to kind of answer your question, anything that is out of the norm for you that other people might be noticing, that if you were always a messy housekeeper and your house is messy, that's not a change, right? But if you always were meticulous in keeping your house and all of a sudden you just don't have the initiation to do it anymore, you're letting bills pile up, or you've been paying bills and there's some errors. There are little tiny things that together could be that something's happening neurologically. So it takes paying attention to it. And again, it's kind of, if it's happening a lot, if it's happening occasionally, chances are it's something that happens to all of us occasionally, right? So I don't know if that answered it. We do have a whole class on the 10 warning signs that goes into greater detail that you can actually watch just recorded on our website. So that's an
Perfect. That was actually the next question was how do I get the 10 warning signs list? So it is just on your website. They could watch a video or
Yeah, and I can send you the link, Tanya, and you can pass
that
it
would
out
be
if you'd
great.
like.
Okay, that would be great. Thank you, Angel.
Yeah. So that processed meat I've already talked about here, the especially those red meats, something that we really want to limit in our diets. And then also we talked about just the fire exposure and wildfire exposure. And our programs and services, we do information and referrals. So if people call us, we can connect them to resources in the community. We do a lot of disease education, whether it's in person or a webinar like this. We do care consultations. So a person may be newly diagnosed or they're just changing stages and families need some support and help with that. We have a lot of support groups. Then we collaborate with a lot of different agencies on our support group. Here in Larimer County, we collaborate with Dementia Together, with Elder House, with Good Samaritan. We have Lots of different, I think 7 per week in Larimer County. So lots of different support groups. We also have early stage program and those online tools that are anywhere from brochures to pre-recorded classes to our 1-800 helpline as well. So I am here to answer any questions. I know this was kind of really quick and a lot of information at once, and happy to answer any questions that you might have.
I'm keeping an eye on it. Sorry, I've got a truck in the background making noises. I don't, anyone else have anything? One thing I do hear a lot about is really that idea of exercising and really increasing kind of even our muscles. Is that just truly a pretty big factor even when it comes to memory? I mean, it makes sense, obviously, for being active and getting around. But I do just keep seeing more and more studies about how it really is a huge factor in your cognitive.
Yeah, and again, a lot of that goes back to that just that good, healthy blood flow, that keeping that good vascular health, but also there's a lot of a lot at play when we exercise from just a mental standpoint, from it can be a cognitive standpoint, it can even be from a social standpoint, because sometimes we do these things with other people. And so all of that really benefits our brain health. And again, if you could only do one thing, really exercise is probably the one thing that you should be doing for your brain health. And whether, it doesn't have to be a marathon, it can be walking, it can be dancing, it can be pickleball these days, lots of different things. So just getting our heart rate up and moving, our bodies are meant to move, not to be sedentary, so that activity can be really important. And actually, there was a really interesting study, and sorry if I'm going over, but really quick. There was an interesting study last year at our conference where they had 2 groups of people, one that did aerobic exercise and one that did strength training and balance. And the hypothesis was that the people that did aerobic exercise would have, all of these people had what we call mild cognitive impairment. So they had some neurological change in their brain. And they thought the people that did aerobic exercise would have less change in a year than the people that did strength training and balance. And what they found out in a year's time is that neither group had both groups experienced very little change in that year. And then they compared that group to a sedentary group who did have significant change. So the takeaway, and it was just one study, so, needs to be duplicated. But the takeaway was we just need to move our bodies in some manner. That, again, we're meant to move, not to be sedentary, which oftentimes our lifestyle these days is in front of screens, whether it's a TV screen or our phone or laptop. And so we really need to be conscious about moving our bodies as much as we can.
I do have another question that pops up. And I also had this with my mother, who I think this is Margot, who said this. We had this as well. My father has been showing memory issues for a year. I'm handling his bills, etc. But he doesn't think he has any issues. How important is a diagnosis? Pronouns are super hard for him, finding his words.
Yeah. And so what I would say is that we know from research that a little over half of the people living with dementia no longer have the brain health to recognize that they have problems. And then the other half do, right? I had a gentleman who his whole journey would say, I don't know, I can't remember because I have Alzheimer's. My husband's uncle, who's 95 and who has dementia, he says, oh, I'm just a little fuzzy. And then my mother-in-law totally denies that she has any problems at all. And she has significant problems, right? So how important is a diagnosis? Part of it is you want to make sure that a person isn't experiencing these things from any other health issue. That being said, that, my husband's uncle is 95 and he has had these symptoms for about 3 years now. Now, he does have kind of just a generic, he doesn't have a diagnosis of Alzheimer's. They're not going to do this huge workup. He doesn't want to, we don't want to put him through it. It's not going to change his quality of life. And not to be ageist at all, but if I am at maybe perhaps a younger age and I'm in the very early stages, maybe I do want to pursue exactly what's going on because there are some things that I might change to impact that. Or maybe I want to, complete my bucket list or get my affairs in order. So, it's kind of we encourage people to get a diagnosis, but also, your family well, your, your dad or whoever it is that is this going to be distressing? Is it going to change things for that person? Now, sometimes people have a long-term care policy where they need a diagnosis if you're going to access that policy. So if you're going to need to have home care come in, if you are going to need a memory care unit down the road, then you do need a diagnosis at some point. Is it going to be, but you can choose, do you want this extensive workup? Or is the doctor saying, well, based on what we're seeing here, based on some test, blood work, whatever, that this is most likely the
Yeah,
scenario?
I was just going to put in my 2 cents. Certainly, it did not matter to my mother, but I do think it helped my father by having a diagnosis. And to your point, it helped us with some paperwork and things like that to actually have it. So I just take that from my personal experience. It didn't matter to my mother at all, and it certainly was pointless for her, but I do think it made a difference for kind of the paperwork and for my father to actually just kind of have an idea.
Yeah, and I think you also made a good point there, Tanya. For the caregiver, sometimes it makes a big difference. One, there's nuances to different types of dementias. So medication relief or how I respond might be a little bit different depending on what that person's dealing with, but also just knowing that this person isn't quote unquote doing this on purpose. That their behavior is because of a brain disease and not because they're just trying to be obstinate or irritable or, whatever.
Um, let's see. Let's see. Oh, someone did mention that their mother was on, I'm sure I'm going to say this wrong, Aricept for 5 years, and she thinks it has helped. Um, and then someone just kind of did a question mark. There really isn't effective meds out there yet, is there?
So in the last couple of years, in 2021, there was a medication called aducanumab. All the drugs I'm going to say are MAB drugs, monoclonal antibody. And so it did pinpoint the beta amyloid in the brain. And so it really pinpoints a particular protein, in this case, beta amyloid, and it did remove the beta amyloid. This is done by infusion, and it does slow the progression of the disease, which is a huge deal because it's the first time the biology of the brain has changed. The medications like Aricept and Namenda, those really treat symptoms, but they don't change the biology of the brain. Then in 2023, lecanemab came out. It was a lot cheaper than aducanumab, and doing the same thing, removing that beta amyloid, still done by infusion, no. And all of these medications are through the neurologist has to be part of a registry so they can monitor these patients long term. Then the FDA just approved a new medication, donanemab, that came out in June, and it's not out to the general public yet because it's brand new. But again, a little bit better than the first two, still removing the beta amyloid. Now, these are all just looking at beta amyloid. There are a lot of other medications out, or a lot of other things in the pipeline in research studies that are we're going to be hearing about as well. So yes, there are medications out there that do tend to slow the progression of the disease. Are they for everyone? No, they're only in very early stage, or what we call mild cognitive impairment, which is even before early stage. And they're not available in all communities. So if you live in rural Colorado, Meeker, Colorado, or, Rangeley or out west in some of those counties that I serve, you have to come basically to the Front Range to get, especially the latest one. So It's a start. It's hopeful because we're really headed in the right direction and the research is just building and building on each other. But again, it's not stopping the disease. It's slowing the progression for some people. That's where we are right at the moment.
Sorry, I was muted. I do, I love that we have two people chatting back and forth, which I think is fantastic. Regarding their mothers, but that's fantastic. I don't see a whole lot of other actual questions popping up, and I guess I see some people are starting to kind of pop off. So I think that is about it. This was great, Angel. I could just tell from our little chat, this is something very interesting. So I will go ahead afterwards. I will email this presentation out. And then if you can email that link, Angel, that would be great as well about the lists of the 10 things or the video that they can watch. And I will also be just kind of making sure that this video is ready to go, and I'll get this also out to everyone.
All right.
Thank you.
Thank you for having me.
Yeah, it was great. So much super information. And I think all of us in one way or another can always use just a little tidbits on how to keep our memory and brain active as we age.
Yeah. All right. Take
Thank
care.
you. All right, thanks.